Good morning, my dear angels in the sick room. Previously, I have pre-recorded the video regarding the different diagnostic tests and therapeutic measures concerning oxygenation and problems with respiratory system. At this time, we will be discussing an important topic regarding oxygen therapy. As we all know, oxygen is very important in our body because without oxygen, cellular respiration won't be possible and oxidation of the cell will not happen. 5 minutes without oxygen in the brain, it would already cause brain damage. So at this time, we will be discussing the different oxygen devices, how many fraction of inspired oxygen it can deliver depending on the type of device that we're going to use to our patient. And of course, we will also be tackling about respiratory tubes, which are also used in advanced respiratory interventions to our patients. So for this topic, we will be including oxygen therapy and respiratory tubes. And the oxygen therapy devices can be categorized into low flow devices, which include nasal cannula, simple face mask, partial rebreather mask, non-rebreather mask, and it also includes high flow devices such as Venturi Mask and AEROSOL devices. So what's the difference between low flow devices and high flow devices? Low flow devices are oxygen devices that cannot provide patient with total oxygen requirements, but high flow devices can provide patients with total oxygen requirement or exact oxygen requirement needed by the patient. So we will be elaborating these devices as we go along with our next slides. Few reminders when we are using oxygen therapy for our patient. We have to assess first the color and the vital signs before and during the treatment. We have to observe signs of respiratory distress. And remember, the earliest sign of hypoxia is restlessness, and it would progress to confusion. At the same time, it would result to what? Unconsciousness. So therefore, we need to assess the oxygen saturation as well of the patient. And aside from that, if there are evident signs of hypoxia, it could be peripheral or central. For peripheral hypoxia, we will be looking at the nail beds of our patient for signs of cyanosis. And for the central cyanosis in our oral mucosa or the perilabial tissues. Place a label that the patient has an oxygen in use and sign at the client's bedside. Assess for the presence of chronic lung problems because chronic lung problems may require a small amount of oxygen to be delivered by the patient, especially for patients who have chronic obstructive pulmonary disease. We do not want to give patient a high oxygen concentration because their breathing might stop. Okay? Don't forget for COPD patients, the maximum liters per minute is only 2. Again, for COPD patient, the maximum liters per minute it's only 2 because the primary trigger for their breathing is the low oxygen, not carbon dioxide level in the blood anymore. And next is humidify the oxygen. Since we are administering a continuous oxygen administration to the patient, unlike with our normal breathing, we have a natural humidifier in the nasal cavity, but in an oxygen therapy device, it is artificial and it requires continuous oxygen administration. So it might cause drying of your respiratory mucosa. But of course, In a very low concentration, like 1 to 2 to 4 liters per minute, humidifier uh, cannot be, or humidifier may not be used because of this low flow oxygen concentration. Then it could not cause respiratory irritation. And the most important thing as well, you take into consideration, especially if the patient is in oxygen therapy, is you put a sign, a no smoking sign in the room or in the oxygen tank if it is not in a wall unit device. So no smoking, because oxygen is highly combustible. Okay, it would cause a fire into the room. Okay, so first we will be discussing a low flow oxygen device. What are the characteristics of this low flow oxygen device? There is a variable FiO2. FiO2 means a fraction of inspired oxygen which is delivered into the patient, and it is equivalent to percentage. But of course, in our oxygen delivery, we regulate it through liters per minute. Okay, and we can use the flow meter and the flow meter regulator to adjust the rate of volume being administered to our patient. And when we say low flow device, it does not meet all the patient's flow requirements. Okay, so there is more or less, um, it cannot meet all the requirements or the oxygen requirements needed by the patient compared with high flow devices. Okay, example of this low flow device include nasal cannula, simple face mask, and rebreathing mask. We have two classification. We have partial rebreather mask and non-rebreather masks. So we will discuss first one example of a low flow system device, the nasal cannula. And this is the correct placement of our nasal cannula. So when you place nasal cannula to our patient, then make sure it is placed this way. Okay, so it is secured in the ear, and you can adjust it through this adjustable system. Okay, and of course, before putting this nasal cannula to the patient, you have to ensure first that proper regulation in the flow meter is considered, the doctor's order is considered. Remember, oxygen is also considered as a medication. So it is ordered by the physician. But in the emergency situation, we can administer oxygen up to 2 liters per minute. And before you put this nasal cannula device or any oxygen therapy device, make sure that there is air coming out from that devices. Okay, so you ensure first na may lalabas na hangin before you put it. So this is a nasal cannula, and of course, this is one of the oxygen device, and it can deliver the least fraction of inspired oxygen to the patient. Okay. So what is a nasal cannula? It is used at a flow rates at 1 to 6 liters per minute, providing approximate oxygen concentration of 24% to 44% FiO2. The flow rate higher than 6 liters per minute do not significantly increase oxygen because of the anatomical reserve or the dead space of the nasal cavity is full. So meaning to say, if you use nasal cannula, you can only regulate the oxygen volume up to 6 liters per minute. More than that, it will be useful because it can only accommodate up to 6 liters per minute regulation. That is because of the anatomical reserve or the capacity of your nasal cavity to accommodate the air from the oxygen device. So even if you regulate it up to 7, 8, 9, 10 liters per minute, it will only administer up to 6 liters per minute, so it would be useful. So if you need to administer more than 6 liters per minute, then you will be advised to use a higher or other devices that could deliver higher fraction of inspired oxygen. Okay, so 4 liters per minute or below, you can um, or maybe it is acceptable. It is not maybe. It is acceptable not to use a humidifier. More than 4 liters per minute, it is already irritating due to continuous air passing to your respiratory tract, and it does not pass through normal humidification in the nasal cavity. Then it needs to be humidified. A nasal cannula is used for clients with chronic airflow limitation and for long-term oxygen use. One of the advantage of a nasal cannula, of course, you can speak, you can talk. It's not, it is more convenient because you can eat. It's not suffocating to the patient. A client who is hypoxemic and also has chronic hypercarbia. Hypercarbia is a term related to increased carbon dioxide in the blood, requires low level of oxygen delivery at 1 to 2 liters per minute. This is what I'm telling you for patients with chronic obstructive pulmonary disease. Since they have chronic hypoxia, the maximum liters per minute that we are allowed to administer is up to 2 liters per minute. That is to prevent uh, apnea to our patient. Effective oxygen concentration can be delivered to the nose breathers with the use of nasal cannula. So what is the formula? Of course, this formula can be estimated for more or less in the using nasal cannula or low levels of regulation and low levels of FiO2 concentration. So how do we do or how do we compute liters per minute into the equivalent fraction of inspired oxygen? So this is just an estimation. So FiO2 or the percentage is equal to liters per minute ordered by the physician times 4 plus 20. You might be wondering, saan kinuha itong 4? Saan kinuha itong 20? 20 is an estimation since when we breathe, 21% of air is or of oxygen is present in the atmosphere. 21% oxygen, 78% nitrogen, and 1% for other content. That includes already carbon dioxide. So actually, we can use 21%, but 20% is an acceptable value so that the result would be whole numbers, or the estimation could be whole numbers. So you can also use 21 if you like. Okay. Where did we get this for? It is estimated that 1 liter increase, 1 liter per minute increase in the regulation is has a 4% increase in FiO2. So dyan kinuha yung 4. So for example, the doctor ordered 4 liters per minute. The FiO2, what is the equivalent percentage of 4 liters per minute in terms of fraction of inspired oxygen? So 4 is the 4 liters per minute. This is the liters per minute times 4. This is constant plus 20. So 4 times 4, 16 plus 20. So the FiO2 for 4 liters per minute is equivalent to 36%. So this is an estimation, but this formula actually can be used for low flow oxygen system. So as you can see with this estimation, we have 1 liter per minute, 2 liters per minute, 3 liters per minute, up to 6 liters per minute. So 24%, as what I've said earlier, that an increase in 1 liter per minute increase is equivalent to 4% increase as well in FiO2. So 24, 28, 32, 36, 40, and 44. So this formula actually is just an estimation of the liters per minute in equivalent to FiO2. This is the percentage of oxygen that is entering the patient. But of course, since this is just a percentage, some of the oxygen entering to the patient is coming from the atmosphere, aside from the oxygen being delivered through these devices. So what are your interventions? You have to place the nasal prongs in the nostrils with the openings facing the client. Nasal prongs has also variation. It could be flared nasal prongs, straight nasal prongs, or curved nasal prongs, depending on the brand and the type to be used. And of course, when we use these devices, we have to make sure that it is appropriate to the size and age of the patient. We add humidification as prescribed. Depending on the rate of flow, you are regulating the oxygen unit. Check the water level and change the humidifier as needed. You can use sterile water in the humidifier. But of course, there are pre-filled humidifier that can be purchased in the pharmacy. Assess the client for changes in the respiratory depth and rhythm. Of course, when you observe the client, you are giving nasal, oxygen therapy through nasal cannula, and the client is manifesting some difficulty of breathing. You check once again the oxygen saturation of the patient. If it is not improving and it is gradually deteriorating, then you might be needing to change to another oxygen therapy devices, which could deliver a higher concentration of FiO2. Assess the mucosa because high flow rates have drying effect and increase in mucosal irritation. You also have to assess the skin integrity because the oxygen tubing can irritate the skin. So make sure you have to check as well the tubing that is wrapping around the cheek of the client. So it might be causing pressure and irritation. Okay. So you provide water-soluble jelly to nourish as needed. Okay. So you can also put some cotton or gauze here below the tubing that wraps around the cheeks so that it would lessen the irritation. Okay. Next is face mask. So this is a simple face mask. As you can see, there are no flops here, no flops, no valve here within the oxygen. And this can be a nebulization set that is attached to the face mask. Okay? So simple face mask can deliver oxygen concentration at 35 to 50%. Actually, there are variations in terms of FiO2 concentrations because some reviewers could deliver this particular rate, and this is according to Potter and Perry, Fundamentals of Nursing. A minimal flow rate of 6 liters per minute is needed to prevent rebreathing of exhaled air. So the minimum flow rate for face mask is 6 liters per minute. Okay, so below that regulation, it is not advisable. Because if you do not regulate the oxygen device to this rate, then you will be re-inhaling the carbon dioxide or the air you have expelled. So regulating up to 6 liters per minute or more could flush out carbon dioxide you have exhaled. So take note of this minimum regulation. As sinabi ko nga kanina, there are variation depending on the book. At some book would say that the minimum regulation is 5 liters per minute. But for this purpose, we will stick with 6 liters per minute for uniformity. So what are your interventions when you use simple face masks? Be sure that the mask fits securely over the nose and mouth because a poorly fitting mask reduces the fraction of inspired delivered oxygen. Of course, your simple face mask is designed na meron siyang flap dito sa ilong so that you can fit it snugly into the nose, okay? Preventing spaces that would allow air to come out from the face mask and affecting, of course, the FiO2 being administered to your patient. Okay, so make sure na i-adjust nyo parati yung sa may nasal area ng face mask. Assess the skin and provide skincare to the area covered by the mask because pressure and moisture under the mask may cause the breakdown. One of the disadvantages as well of using face masks is that if the patient vomits and nakakover yung mukha niya, pwede niyang pumasok ulit yung vomit juice and ma-aspirate ang pasyente. Monitor the client closely for risk of aspiration because the mask limits the client's ability to clear the mouth, especially if vomiting occurs. Provide emotional support to decrease anxiety in the client and who feels claustrophobic. Consult with the physician regarding switching the client for mask nasal cannula during eating. So, if the client needs to eat and we can put on standby the nasal cannula. For the meantime, kapag kakain ng pasyente, swap muna, and then after the patient eats, we change it to the face mask. But of course, we need to monitor the oxygen saturation of the patient to ensure that adequate oxygen is entering the patient and enough oxygen is distributed to the different parts of the body. And don't forget, if the patient would manifest difficulty of breathing, providing food or drinks is strictly prohibited, or the patient should be placed in NPO all the time, unless the breathing stabilizes. For simple face mask, 35 to 50 liters per minute, 50%, we can regulate it to 6 to 12 liters per minute. In some textbook, it is 6 to 10 liters per minute. Pyramid point, flow rates must be set, ito yung gina-emphasize palagi, to 6 liters per minute to flash the mask of carbon dioxide. So don't forget. So let's now proceed with partial rebreather mask. A partial rebreather mask consists of mask with reservoir bag that provides an oxygen concentration of 60 to 90% with flow rates of 10 to 15 liters per minute. Actually, the partial rebreather mask and non-rebreather mask has the same regulation. It can also provide up to 60 to 90% FiO2. But there is a difference in terms of the structure of the mask or the whole device. The client rebreathes 1/3 of the exhaled tidal volume, which is high in oxygen, thus providing a high FO2. So the reservoir bag, itong reservoir bag ng partial rebreather mask, as you can see, walang valve sa gilid. No, but there is a reservoir bag. The reservoir bag should be 2/3 full of oxygen. Okay? So may hangin dyan galing sa oxygen natin source. At the same time, yung na-exhale ng pasyente, pupunta dito, marire-inhale niya ulit. So, aside from the oxygen source, the oxygen being exhaled by the patient is also being re-inhaled so that they can provide a higher oxygen concentration. Okay? So, make sure that the reservoir does not twist or kink, which result in deflated bag. Adjust the flow rate to keep the reservoir bag inflated 2/3 full during inspiration because deflation results in decreased oxygen delivered and rebreathing of exhaled air. Okay, so in that case, there would be a lot of carbon dioxide that will be re-inhaled by the patient, causing what? Respiratory acidosis. So this is a partial rebreathing mask, 10 to 15 liters per minute, 60 to 90% oxygen, FiO2, and do not humidify. When you can see, there's no flap here. There is a valve here, but only one side, and the other does not have any valve. Okay? So, since there's no one univalve here, then pag exhale mo, papasok dito ang hangin, plus may oxygen content na ito, marirebreathe ng pasyente some of the exhaled here. Of course, remember, out of 21% of inhaled oxygen from the atmosphere, 5% is utilized, 16% is exhaled. So, it still has a lot of oxygen concentration exhaled by the patient. And talking about non-rebreather mask, a non-rebreather mask provides the highest concentration of low-flow system and can deliver an FiO2 of 60 to 90%, that is according to Potter and Perry, at 10 to 15 liters per minute, depending on the client's ventilator patterns. A non-rebreather mask most frequently is used in the client with deteriorating respiratory status who might require intubation. The non-rebreather mask has one-way valve between the mask and the reservoir bag and two flaps over the exhalation ports. The valve allows the client to draw the entire quantity of oxygen from the reservoir bag. The flaps prevent the room air from entering through the exhalation ports. During the exhalation, air leaves through these exhalation ports where the one-way valve prevents exhaled air from entering the reservoir bag. Okay? Remove mucus or saliva from the mouth. Ensure that the valve flaps are intact, functioning. Suffocation can occur if cerebral bag kinks, oxygen source disconnects. So this is the non-rebreather mask. This is the exhalation ports and inspiration valve. Okay, unlike with partial rebreather mask, you don't have expiration valve. Okay. And the inspiration valve. So this is a partial rebreathing mask. Okay, this is a non-rebreathing mask, and this is the reservoir bag. So what is unique about non-rebreathing mask is that when you inhale, you will get all the oxygen from the reservoir bag, and when you exhale, it is the exhaled air goes out through these flaps, and it prevents atmospheric air from entering your oxygen devices. Compared to partial rebreathing mask, some of the oxygen in the atmosphere can also be inhaled. Okay, but in non-rebreather mask, it does not allow air from the atmosphere from being inspired. Okay, but it allows all the air or a high concentration of air in this reservoir bag to the client. And kapag mag-exhale ang client, lalabas lang siya dito. Okay? So that is non-rebreather mask. And no, for rebreather mask, either non-rebreather mask or partial rebreather mask, you do not put humidifier. Why? Because the rate of oxygen administration is very high, 10 to 15 liters per minute. And when you set it at very high level, pag iset mo yan na 10 to 15 liters per minute, pansinin niyo ang humidifier, the bubbling, or it would cause an increase in bubbling in the humidifier, causing a leak to it's either in the reservoir bag or in the tubing. And remember, when there is moist in the reservoir bag, or even if the mist goes to the tube, it would decrease the FiO2 being administered to the patient. Bakit hindi kailangan bakit hindi dapat tayo maglagay ng humidifier? Because of course, rebreather masks should not be used in long-term oxygen therapy to your patient. So, we just need to reassess kung kailangan talaga ng, kung hindi nag-i-improve ang pasyente with other oxygen therapy devices, kailangan siya ng rebreather mask, and kailangan siya in a uh, long-term basis, then we could possibly use other advanced treatments such as endotracheal tube insertion to your patient, which can be attached to a resuscitator or a mechanical ventilator. Okay? So, hindi matagalan dapat ang rebreather mask. So, we need to assess from time to time any improvement of the patient condition, then we can shift to other oxygen therapy devices. Do not put humidifier because of a very high flow rate concentration, which could cause moist in the reservoir bag or in the oxygen tubing. Okay? So, ayan, ang ating, this should be, remember, you also have to look at the reservoir bag of the patient. When the patient inspires or inhales, the reservoir bag should not be fully deflated. Okay? Dapat may maiwan siya na hangin. And when the patient has problem with oxygenation, we can also place the patient into a good position. It could be semi-Fowler's position or sitting position. This would allow adequate lung expansion. Okay? So this is an example of a non-rebreather mask. So when you look at this non-rebreather mask, these are the flaps, the exhalation ports, and this is the inhalation valve. Okay. So when you inhale, it will open and it would allow you to inspire the oxygen in the reservoir bag. And when you exhale, this port closes. Okay. Hindi papasok dyan yung mga exhalation mo ng sa pasyente. Okay, actually face tent fits over the client's chin with the top extending halfway across the face. The oxygen concentration varies, but the face tent is useful instead of tight-fitting mask for the client who has facial trauma or burn. So, dito siya fit snugly sa chin. Okay? Especially if the patient have facial injury or burn, so that it would not cause irritation or pain in part of the patient. And actually, face tent, when attached to a large bore tubing in a oxygen device, then this could be considered as a high flow oxygen system. But the consideration whether it could be high flow or low flow, depending on the type of tubing we use to our patient. So this is an example of a face tent. This one. So let's now proceed with high flow devices. So in our low flow devices, to recapitulate, we have the nasal cannulae. We have, of course, 1 to 6 liters per minute regulation. Okay. And we also have simple face mask. We also have rebreather mask, the partial rebreather mask and non-rebreather mask. For simple face mask, we can regulate it 6 to 12 liters per minute, and in some books 6 to 10 liters per minute. But the minimum flow rate we have to consider, especially in simple face mask, is we set it to 6 liters per minute. That is to flash off exhale carbon dioxide in the mask. And next is partial rebreather mask and non-rebreather mask with the same regulation, 10 to 15 liters per minute, and with the reservoir bag, and it can deliver FiO2 up to 60 to 90%. But of course, with the minimum regulation of 10 liters per minute. And one thing you have to consider, we do not put humidifier if the patient will be using the non-rebreather or even partial rebreather masks. So let's now proceed with high flow devices. High flow devices, what are the characteristics? It is fixed delivery and it can meet all patients' flow requirements. Example of this are aerosol devices, Venturi devices, or air entrainment masks. So one of the example of a high flow system are the large volume nebulizer, wherein we can set it to 5 to 15 liters per minute and it can deliver an FiO2 of 28% to 100%. Is itself a humidifier. This is a humidifier. We can put sterile water here, but of course with a appropriate volume. And this is the air entrainment. So we can actually regulate by adjusting the air entrainment device. No? So depending on the desired FiO2 or liters per minute. Dito yung i-connect ang large bore tubing natin, which can be connected to either a tracheostomy mask, what else? You can connect it to aerosol mask. As you can see, para siyang face mask, but this one, the hole here is larger compared to your face mask. Diba may mga butas-butas ito, mas malaki ang ano. And this one will be connected to your large bore tubing. Dito i-connect siya, no? Dito replaceable ang water. But this one is a type of large volume nebulizer which is disposable. We can also attach it to tracheostomy mask or collar. Ayan. And sa face tent. Pwede rin natin i-attach yung nebulizer sa face tent. Okay? So, this is a variation as what I've mentioned earlier. Though this can be a high flow device, but it depends on the type of tubing. Kapag large bore ang tubing, i-connect sa large volume nebulizer, then this could be a high flow device. But if ito, ganito, medyo maliit ang tubing niya, so it is a tracheostomy collar or a face tent, then this could be considered a low flow device. So yun ang ating consideration. So aerosol mask is used for client who requires high humidity after extubation of the upper airway surgery or the client who has thick secretion. Ayan, yung pinakita kanina, malaki ang butas dyan. Tracheostomy collar or TPs can be used to deliver high humidity at the desired oxygen to client with tracheostomy. A special adapter called TPs can be used to deliver any desired FiO2 to the client with tracheostomy, laryngectomy, or endotracheal tube. So this is a Briggs adapter or a TPs adapter. Pwede ito dito, this is your from the oxygen source. And dito, pwedeng open lang or may i-attach ka pa na other tubing for exhalation. This is a tracheostomy collar. Ayan. Change delivery system to nasal cannula during meal times. Assess that the aerosol mist escapes from the vents in the delivery system during inspiration and expiration. Empty condensation from the tubing to prevent client from being gavaged with water and promote adequate flow rate. Ensure that the sufficient water is in the canister and change the aerosol water container as needed. This is for face tent, aerosol, and tracheostomy collar. Keep the exhalation port at TPs open and uncovered. If the port is occluded, the client can suffocate. Same as with non-rebreather mask. Remember your non-rebreather mask? Wala siyang area wherein the atmospheric air can enter. So kapag may blockage in the exhalation ports as well as in the univalve, in the servo bag, it would suffocate the patient. So you have to check for possible kinking or blockage in these ports. Make sure the humidifier creates enough mist. A mist should be seen during expiration and expiration. So one of the devices which delivers a high flow system is a Venturi Mask. Okay, among all oxygen devices, Venturi Mask provides the most accurate FiO2. Again, among all the oxygen devices, Venturi Mask provides the most accurate fraction of inspired oxygen, which is a high flow oxygen device. Operation of the Venturi Mask is based on the mechanism that pulls in a specific proportional amount of air in each liter flow per minute. Okay, so we will try to look at, so yung pasyente kung kailangan talaga niya ng exact FiO2 delivery, Venturi device or a Venturi mask can be used. It can deliver up to 24 to 50% FiO2 with flow rates of 4 to 10 liters per minute. Okay? So this is an example of a Venturi adjustment device. Now, meaning to say, merong iba na isahan na lang na adjustment. Ito, we can adjust it accordingly. And, meron dito na may adjustable na lang. Isa-set mo na lang siya kung ilang order. 4 liters ba? 5 liters? 6 liters? But, on the other hand, meron rin tayong mga entrainment na with different colors. And these different colors has specific flow requirement. For example, kunwari itong orange, 4 liters per minute, white, 5 liters, 6 liters, 7 liters, depending on the label of the Venturi device. So monitor client to ensure an accurate flow rate for specific FiO2. Keep the orifice for the Venturi adapter open and uncovered to ensure adequate oxygen delivery. Ensure that the mask fits snugly and the tubing infers kink. Assess the client for their mucous membranes, humidity, or aerosol can be added to the system. So let us look at a Venturi device.
So let's go over the Venturi mask next. First, I'm going to show you how to put it together. So there's 5 pieces to every Venturi mask setup. Of course, the aerosol mask, we have a piece of corrugated tubing. We have our oxygen line that will run to our flow meter. We have this piece right here, which I'll show you what this is all about shortly. And then we have the most important part, which is what they call these are a fixed orifice device. And I don't know if you can see with the camera, but every one is a different color. And written on each one.
So the appropriate term for these devices is a fixed orifice devices. And each color has corresponding flow rates, no, in liters per minute. So meron rin siyang corresponding FiO2. So for example, ang color white, example lang, color white is of 40% FiO2. So nakalagay na rin dyan sa fixed orifice device kung ilang flow rate ang i-regulate mo. Nakalagay dyan, 40% at 8 liters per minute. So, pag itong white ang nilagay mo dito, i-regulate mo rin yung flow rate up to 8 liters per minute.
It's a percentage in a liter flow. And I'll show you that in just a second. But let's just take, I know that the orange is 50% oxygen. Now the great thing about a Venturi mask is this is the only oxygen device that you can use to deliver exact FiO2s or an exact percentage of oxygen. It works off of the Venturi principle. Each one of these orifices is a different size. This one here says 50% and it says 15 liters. I'll show you how to set this up. First of all, the corrugated tubing piece goes on the mask. This. All right. The next piece would be right here. This is the Venturi piece. It goes on the end of that. You might have seen a patient with one of these on before. The oxygen tubing connects to this. And that's how you're usually going to see them. But there's one part that a lot of people leave out, and it's this extra piece. Right here. This should actually go right here and keep The holes, or these air entrainment ports, keep them patent at all times. Here's the reason why. Because from our flow meters coming 100% oxygen down the tube through this fixed orifice, and it comes through it at a specific flow at 15 liters. And the really cool thing about this device is when that comes at 15 liters at 100% coming through the center hole, it's going to pull in exactly the same, since this is 50% oxygen, it's going to pull in the exact amount of air to...
So the principle of Venturi device is, aside from the oxygen source being regulated, it also pulls atmospheric air. So meaning to say, Venturi device, it gets air from the oxygen source or the oxygen tank. And aside from that, yung hole dyan, it also, It also allow the atmospheric air from entering the device. So, imimix na yung oxygen source mo, pati yung atmospheric air. But, yung i-enter niya sa pasyente, it's just the appropriate or the exact concentration of oxygen that is set by the by this entrainment, fixed entrainment device.
To mix with the oxygen to deliver that 50% up here at the patient. That's why you have it up and ran at 15 liters to the wall. Oxygen going up here. It's not going to be 50. The sheet lays over it. It's still going to pull in that room air and give the right...
Okay, so what is the purpose of this? Pwede nyo ilagay, pwede rin hindi. Yung itong transparent na ito. Kasi nga, the principle of Venturi, it pulls atmospheric air. What if matakpan siya, no? So, hindi na magiging effective or magiging accurate yung oxygen delivery system, no? Matakpan ito mga butas dyan. So, anong purpose nito? That is to what? To protect this device from being blocked. So, nandyan lang yan siya. So, kahit madaganan siya, mapapasok pa rin na atmospheric air. Okay? So, those are different devices. No? We have the high-flow devices, low-flow oxygen system, and high-flow oxygen system. So, high-flow oxygen system includes aerosol mask or large nebulizer devices and Venturi device. But among those devices, the most accurate oxygen delivery is the Venturi device. So we will now proceed with respiratory system tubes. This include endotracheal tube, and we have this pilot balloon. We have the cuff, and of course, we have the ET tube. Okay, but of course, when you will be preparing the patient for ET tube insertion, you have to make sure you prepare the following equipment. First is you have to prepare 10 cc syringe. And then you also prepare, of course, gloves for you and for the doctor kasi mag-a-assist ka. Ano pa? The laryngoscope. What else? Guide wire. Kalimutan. The resuscitator or ambu bag. What else? Stethoscope, that is to check whether the ET tube is in place or not. So these are the things you will be preparing, especially when you assist the doctor in inserting in the tracheal tube. And the endotracheal tube, of course, would depend on the age and size of the patient. Okay? So endotracheal tubes are indicated to the client that needs mechanical ventilation. So if the client's breathing stops, or if the client is already apneic or manifests agonal breathing, then ET tube insertion is necessary. If the client requires artificial airway for more than 10 to 14 days, so the tracheal a tracheostomy be created to avoid mucosal and vocal cord damage. So meaning to say, kung sa ICU ka, kasi sa ICU usually nakikita natin to, kapag ang pasyente naka-tube, so ninonote nila kailan ininsertan ng pasyente ng endotracheal tube. And kailangan siya mag-dew. Kapag 14 days na, 10 to 14 days, the doctor will already talk to the watcher or the significant others na kailangan ng palitan ng tube, kailangan na ng pasyente ng tracheostomy tube. To avoid mucosal and vocal cord damage that can be caused by endotracheal tube. So, iti mo na siya temporarily. Or not iti, tracheostomy mo na siya temporarily. So, 14 days lang. After 14 days, the patient will be advised, the significant other will be advised to shift to tracheostomy. That is another operation. So this is the cuff. Ang purpose ng cuff, of course, is to seal off the airway and prevent any aspiration. And this is the pilot balloon. This would help you determine whether the cuff inside is inflated or not. You can also check it before it is inserted. You check the integrity of the pilot balloon and the cuff. Of course, we need a laryngoscope. Stethoscope as well. The cuff, when inflated, produce a seal between the trachea and the cuff to prevent aspiration and ensure the delivery of a set tidal volume when mechanical ventilation is used. Okay, so isisil niya kasi para kung ano yung iset mo sa mechanical ventilator, yun lang din ang papasok sa pasyente. Okay, exact. Ayan. So, placement is confirmed by a chest X-ray film. Correct placement is 1 to 2 centimeter above the carina. Okay. But of course, this is the ideal. So, dapat X-ray to confirm the placement. But in our setting, especially in government hospitals or even in hospitals here in our locality, ang gagawin na lang is to check the patency or the correct placement of the tube is to auscultate the lung fields as well as the stomach. Okay, kasi we attach it to our ambu bag or the resuscitator, and pag pump dapat equal, may lung sound dito, and then pag pump again may lung sound dito. So it dapat equal ang kanilang equal ang marinig mo during auscultation. So kapag malakas dito, mahina sa kabila, meaning to say more or less the ET tube is inserted too deep and it is placed into the right primary bronchi. So, kailangan i-withdraw konti ng doctor. If breath sounds and chest wall movement are absent on the left side, the tube may be in the right mainstem bronchus. Perform auscultation in the stomach to rule out esophageal intubation. So, kailangan sa stomach kasi kung sa esophageal intubation, doon pumasok sa esophagus because there is a very thin line between the larynx and the esophagus. Ayan lang, sa likod lang. No? So, there is a tendency that ma-insert, mistakenly doon ma-insert sa esophagus. So, kaya nga, dito sa both lung fields and ang last sa stomach. That is to confirm na hindi siya na-insert sa esophagus. Because pag sa esophagus, ika lang ang pump, walang oxygenation ng pasyente, nagtataka ka na bloated na ang pasyente. So this is the carina. Ayan, nakita niyo dyan. This is the bifurcation. So dapat 1 to 2 above the carina ang tube. Dili sa primary bronchi. So if the tube is in the stomach, louder breath sounds will be heard over the stomach than over the chest, and abdominal distension will be present. Secure the tube with adhesive tape immediately after intubation. Monitor position. Monitor the skin, mucous membrane. Suction the tube only when needed. So dito kasi iti-tape mo yan dito yung tube. So you can also alternate it, ilipat na naman sa kabila. That is to prevent possible irritation dito sa skin. Suction the tube when needed. Okay, so ayan. So the oral tube needs to be moved to the opposite side daily to prevent pressure and necrosis of the lip and mouth area. Ito na yung i-alternate natin dito. bukas dito na naman sa right, then left, right, left, right. Prevent dislodgement or pulling of the tagging on the tube, suction, coughing, and speaking attempts by client place extra stress on the tube and can cause dislodgement. Keep resuscitation bag at the bedside at all times. Assess pilot balloon to ensure that the cuff is inflated. Maintain cuff inflation, which creates a seal and allows a complete mechanical control on the respiration. Monitor cuff pressure at least every 8 hours. They should not exceed 20 millimeters of mercury. Okay, so this is some skill on endotracheal tube suctioning.
Now let's discuss the specific technique of suctioning through an endotracheal tube. Observe BSI precautions during this procedure. Explain the procedure to the conscious patient. Position the patient in a supine position. Check and assemble the equipment. Pre-oxygenate the patient. In the case of pulmonary edema, your partner should hyperventilate the patient prior to suction. However, for most cases, if the patient has debris or vomitus in the ET tube, then just suction directly and do not bag the debris down the tube into the lungs. Approximate the length of the catheter to be.
So that is how you measure the approximate length of insertion of the suction catheter.
This is about to the level of the carotid. Keep the catheter sterile during measurement.
Actually, pag-insert nyo yan, and may na-meet na obstruction, you already have touched the carina, i-withdraw mo konti before you start suctioning. Okay? So anyway, we will practice that during your return demonstration. So before you extubate the patient, you make sure you, extubate means tanggalin na yung endotracheal tube. Make sure you hyperoxygenate the client and suction the endotracheal tube and the oral cavity. Of course, kapag naka-attach ito sa mechanical ventilator, may press ka na lang doon sa mechanical ventilator na hyperoxygenate. It will just provide high oxygen concentration to the patient at a given time. Pag naka-ambue bag naman ang pasyente, then we pump it 5, 1, 2, 3, 4, 5 to hyperoxygenate the patient. Place the client in semi-Fowler's position. Deflate the cuff, have the client inhale, and at the peak inspiration, remove the tube, suctioning or airway through the tube while pulling it out. After the removal, instruct the client to cough and deep breath to assist in removing accumulated secretions in the throat. Apply oxygen therapy as prescribed, monitor respiratory difficulty, and contact physician if respiratory difficulty occurs. And one thing you have to take note is that you have to inform the client that if hoarseness or sore throat occurs, that is normal, and that the client should limit talking if it occurs. That is to allow the irritated respiratory tract to heal and prevent further irritation. Let's now proceed with tracheostomy tube. Okay, same thing. We have your what's this pilot balloon? We have the cup. We have the neck piece, and we have the obturator. Obturator is needed. That is to guide the insertion of the tracheostomy tube. Okay. So a tracheostomy is a stoma opening that results from a tracheostomy. That could be permanent or temporary. So let's look at tracheostomy procedure. So that is for slicing sa my neck area below the thyroid cartilage to make an opening into the trachea. Ayan. So satayin mo na lang nila yung edges. Leaving it open. Ayan. For the tracheostomy insertion. So that is how tracheostomy is done. Okay? So, ayan. So, you have to assess for respiration and bilateral breath sounds, monitor arterial blood gas and pulse oximetry, encourage coughing and deep breathing, exercise. Maintain a semi-Fowler's to a high Fowler's position. Okay? So, of course, since endotracheal and tracheostomy tube, the trachea is sealed, then the patient cannot speak because there's no air coming out from the respiratory tract to create a vibration, especially in your vocal cords. But tracheostomy tube has types. Depending on the type, the patient can speak. I will present it later or during the types of tracheostomy tube. Encourage coughing and deep breathing. Maintains a semi-Fowler's to high Fowler's position. Monitor for bleeding, difficulty with breathing, absence of breath sounds, and crepitus. Crepitus is also called as subcutaneous emphysema, which are indications of hemorrhage, pneumothorax, and subcutaneous emphysema. Provide respiratory treatments as prescribed, suction fluids as needed, hyperoxygenate the client before suctioning. But of course, kapag naka-tracheostomy, endotracheal tube ang pasyente, especially naka-attach ito sa mechanical ventilator, you can already observe that the oxygen saturation is gradually declining. Okay, bumababa na ang oxygen saturation ng pasyente. So baka nag-accumulate na yung mucus secretions that you need to suction. The same principle, you need to hyperoxygenate the patient before suctioning this tubing. Okay, so you read this, if the client is allowed to eat, if the client upper meals, ensure the cuff is inflated. Of course, kapag inflated ang cuff, you can ensure that the patient will not be aspirated. So administer humidifier oxygen as prescribed for normal humidification because it bypasses in the clients with tracheostomy. Keep resuscitation bag, obturator, clamps, and tracheostomy set at bedside for emergency purposes. So let's see how to do a tracheostomy care.
Before providing tracheostomy care, ensure privacy. Perform hand hygiene. Gather your supplies and introduce yourself to the patient.
Good morning. My name's Erin. I'll be the nurse taking care of you today.
Then identify her using 2 identifiers.
Can you go ahead and tell me your full name and date of birth?
Carolyn Lance, 3672. Begin your care by clipping a pulse oximeter to the patient's index finger. Either hand is fine.
So this is an example of a tracheostomy mask. Ayan, sa pasyente.
Either hand is fine. Place and have table.
So this is a wall unit oxygen. Wall unit oxygen source. So mga hospital ngayon wala na mga oxygen tank because hassle pa and mabigat, no? So ang ano ng wall unit is meron silang area na centralized yung may yung itong mga wall unit na ito nakakonect sa centralized area ng oxygen source. And pag maubos yung source doon sa central area, mag-alarm, may alarm yan no, kapag maubos. So they need to change it immediately.
Verification are in place. Open the package for the tracheostomy tube holder according to the manufacturer's instructions. If your patient has a disposable inner cannula, open that package now. Then open a tracheostomy care kit, which contains 4x4 gauze, cotton-tipped applicators, dressing, cleansing brush, drape, and a suction catheter. Pour 1/2 inch to 1 inch of normal saline solution into the sterile basin. Don't recap the bottle of saline. Now hyperoxygenate the patient by adjusting the ventilator settings or by increasing the oxygen rate. Apply sterile gloves for suctioning. Remember, you'll need to keep your dominant hand sterile throughout the suctioning procedure. A patient with a tracheostomy sometimes has excessive peristomal secretions. To look for such secretions, apply clean gloves and a face shield if needed. Examine the tracheostomy site for soiled or damp dressings. Then suction the tracheostomy carefully to remove mucus.
Before you insert the suction catheter, make sure your thumbs out ka muna. Ha? You do not cover the suction port yet. Okay.
Before you take off your gloves, remove the soiled tracheostomy dressing and coil the suction catheter in your palm. Discard them inside your glove.
I'm going to go ahead and take out your inner cannula.
To care for a patient whose tracheostomy has a disposable inner cannula, withdraw the used inner cannula, touching it only on the outside. Quickly inspect the cannula for secretions and dispose of it. Then place the new inner cannula and lock it into position.
Okay, I'm going to clean one in.
If necessary, reconnect the patient to the ventilator or other oxygen source.
I'm going to clean out your inner cannula.
That is if the inner cannula is not disposable. You need to clean it. Kapag disposable, mas convenient kasi itatapon mo na lang tapos papalitan ng bago. You don't need to clean anymore. But of course, mas convenient sa patient, especially economically, kapag ang cannula is reusable. So that we'll just be cleaning it.
And use the sterile brush to remove secretions from it, both inside.
So we use actually diluted hydrogen peroxide or the sterile normal saline to clean the inner cannula.
Then rinse it with normal saline. Replace the inner cannula and re-engage the locking mechanism. If necessary, reattach the oxygen source and hyperoxygenate the patient. Note that tracheostomies may lock in different ways. Some must be squeezed to release and reattach.
So that is how you withdraw the inner cannula. So it could be in a lock system or squeezing, depending on the brand and the manufacturer. That is a twisting type.
I'm going to clean around the tracheostomy site and change the dressing.
With either type of cannula.
So first you suction, and then next is you clean or change the inner cannula, and then you do the dressing.
Then clean the stoma. Begin at the inner edge and move outward in circles, covering a 2 to 4 inch margin around the stoma. Be sure to include the area under the faceplate.
Of course, when you clean, you also have to observe any signs of infection in the stoma. No? There might be irritation and infection.
Apply a new drainage sponge.
So yung gauze dyan na ginamit sa dressing should not be yung gigunting mo, but it should be free cut.
Okay?
Pre-cut, not free cut. Pre-cut gauze intended for stoma dressing. Kasi bakit pre-cut siya? Yung walang himulmol. Because yung himulmol, baka pwedeng pumasok doon sa stoma, no? Causing ma-infect pa yung lungs niya, or it would the patient can be aspirated.
Either side of the trachea. You may want an assistant to hold the tracheostomy tube as you work. If an assistant is not available.
So we have two options in changing the tracheostomy collar. Itong nakatali dyan sa kanya to secure the tracheostomy. Kapag dalawa kayo, pwede ang isa i-hold niya habang tinanggal mo yung old collar. Pero kung ikaw lang isa, don't remove it yet. Replace it with new one. Kasi para secure siya while you are changing the collar. Kasi baka accidentally ma-pull yung tracheostomy.
Leave the old tracheostomy tube holder in place until the new device is secure. Align the strap under the patient's neck. The Velcro attachments should be positioned on either side of the tracheostomy tube. Then place the narrow end of each tie under and through the eyelets on the faceplate and secure the Velcro closures. Feel okay?
So make sure it's not too tight. You can insert your finger para medyo maluwang siya.
The neck strap has only enough slack for 2 fingers to fit snugly beneath it,
Iganon mo.
or for 1 to fit loosely.
2 fingers. Ayan.
Are you comfortable?
When you've finished providing tracheal liquid,
So that is how you provide tracheostomy care. So papracticean din natin yan in our skills laboratory. Okay? So we have the different parts of tracheostomy tube. We already identified it.
so it should be flat against your trach tube in place. It should be flat here. Look carefully at the parts of the tracheostomy tube. You can see here is the neck plate.
So this is the neck plate. And dyan sa neck plate nakalagay yung kung anong size ng neck plate. Okay, so that pag replace, alam mo kung ano yung size.
Called the inner cannula.
So that is the inner cannula, no? May lock-lock siya na system type.
And change they have blocked the neck by the neck plate.
Oh, that is the pilot balloon. Inject ka ng air and then you check whether the cuff is inflated. Okay?
Special breathing treatments or have other special.
So that is the parts of the tracheostomy. So we have double lumen tube. Ang obturator is tiled with smooth end to facilitate the direction of the tube. So kailangan din to sa bedside. Now we have the resuscitator, the obturator at the bedside for reinsertion of the tube. Okay, double lumen, Robertson double lumen tube, single lumen. We have cuff tube. We have cuffless. Yung sa mga cuffless naman, kapag ang pasyente naman kaya i-protect ang kanyang sarili against aspiration, can cuff. So we can also use cuffless tube. Ito yung mga cuffless tube natin. And this is your obturator sa pinakagilid. Fenestrated tube naman kapag kailangan na i-win ang pasyente sa tracheostomy. So may butas na siya doon sa upper airway, no, na pwedeng daanan ng hangin. Okay? So ayan, you can see this fenestration, no? Ito yung nandito sa tracheostomy, tapos meron din siyang port para doon sa upper airway na above the trachea. So you observe kung okay na pasyente, meron na siyang spontaneous breathing. Okay. We also have metal tracheostomy and we have talking tracheostomy. May pre-press ka lang na port para ang air lalabas doon sa upper respiratory tract for you to speak. We also have modern speaking valves. Ayan, ina-attach lang sa tracheostomy. We also have
Focus on the physical needs of the patient.
ayan, how would you communicate patient with tracheostomy? Because it's quite challenging. The patient cannot speak, so we need to improvise. Even the stroke patient who have this arthria, so they cannot actually speak well, so we need to provide them with a mean of communication so that you can foster participation from the patient, and you would really know what is the problem of the patient.
I can only imagine patient.
So they have these patterns on what they're going to ask, ano yung mga gusto nila, so that they will feel also independent. And this is a transesophageal voice prosthesis. Ayan, may prosthesis yan sa loob. These are for patient with laryngeal cancer. Tinanggal na yung larynx. So this is also an alternative. The TEP, transesophageal voice prosthesis. And this is how the TEP device is being created or inserted to the patient. Ayan. This is the neck operation. This is your tracheostomy sites. Okay. So that is all about oxygen therapy, and I hope you have understood the different oxygen delivery devices as well as the different oxygen tubes or respiratory tubes. If you have some questions, please take note all of your questions, and you can raise it during our Zoom conference, or you can message in our group chat. Okay? So please review on this video, and I hope you learned something. Thank you very much. God bless you all.